Good afternoon, everybody. It's 2 o'clock Eastern on a Wednesday afternoon, Eastern time rather, on a Wednesday afternoon, so that means it's time for the Retention Academy. Welcome to our second office hour. I'm Suzanne Spear, and joining me from ACU are Ann Hogan and Mariah Blake. In just a minute, I'm going to turn it over to Anna Rogers with CHC Inc., and she will take us through the homework assignment for the week, and then answer any questions you might have regarding the assignment. We'll then use the rest of the time we have together to answer the questions that we weren't able to get to during last week's webinar, and I know there were quite a few of them. So once Anna has had a chance to reveal the assignment, we are going to post it on the discussion board for you to download. Once you've completed the assignment, please post your results there by next Wednesday, March 14th. We'll have this office hour for 30 minutes, keeping it in line with the time limit that we've set for all of our Retention Academy sessions. Feel free to answer questions via the chat or questions box, and we'll answer just as many as we can. If you're comfortable, feel free to chime in after the homework assignment is presented, and at that time we'll take everyone off mute. Everyone is on mute right now, so just FYI, if you're trying to ask a question, everyone is on mute, so we'll wait until after the homework is revealed for to go ahead and do that. So I'm going to go ahead and pull up the homework and turn it over to Anna Rogers with CHC Inc.
Great. Hi, everybody. Good afternoon. Thanks so much, Suzanne, for inviting me to participate. Just to give you some context, so last week we really talked about how team-based care can really support the provider and reduce burnout. We didn't really get into too much detail, with a half an hour. Team-based care is such a broad topic. It's a hot topic. And we really wanted to really just focus on how the team can support the provider. When we were thinking about the homework assignments, though, we went back and reflected on a learning collaborative that we hosted from CHC last year. It was a 10-month intensive learning collaborative with 15 health centers who really wanted to go from, the planning stage or thinking about applying for PCMH recognition to really implementation and making practice transformation changes to their workflows and to their clinics. So we picked out 2 assessments that we used with the teams in this learning collaborative. The first is, actually, I'm going to scroll. Suzanne, do I have? Oh, yeah, I do. Okay. So I'm going to scroll down. The first one that I want to talk about is the Primary Care Team Guide Assessment. And the Primary Care Team Guide Assessment was developed by the McCall Center for Healthcare Innovation at the Group Health Research Institute out in Seattle. We partnered with them on a project called LEAP, Learning from Effective Ambulatory Practices. And the assessment was created by McCall in collaboration with Qualis Health for the Safety Net Medical Home Initiative and was really supplemented by measures that were developed by Tom Bodenheimer relating to his 10 building blocks of high-performing primary care. So I'm sure many of you are familiar with Tom Bodenheimer and Dr. Ed Wagner, really just catalysts in the team-based care movement. And so the Primary Care Team Guide Assessment can be found on improvingprimarycare.org. And we sort of formatted it to fit our needs for the learning collaborative. And so we put it into a survey, which you'll see the link on the page right now. You could just click that survey. And what this does is really, it's tracking it's assessing your clinic, your workflows, your team members, and it's really measuring how your primary care teams are functioning now and to point towards improvements on advancing team-based care. And it's also a way for you to track progress towards practice transformation. So, I'm sure many of you are at different levels of team-based care. And ones that you might want to focus on with this assessment are, the practice team You can't see all of them here, but it really breaks it down into the different core and extended team members. And so we would suggest taking this assessment and having one of your clinical teams, a provider, an MA, an RN, maybe a front office staff person, and a clinical leader sit down and do the assessment together and really understand and sort of come to a consensus on where your practices are currently at. There are four different levels. And when you download the primary care team guide assessment, it will provide you with an explanation of where the levels are. Level A is you are functioning at the highest level of team-based care, and level D is we're really just getting started. I'm sure several of you will fall sort of in between level C and D. But within each level, there are 3 sub-levels. And so we often have many questions about those sub-levels. So while you might read the description for a level C in terms of workflows or the role of the MA, you might be at a higher functioning level within that description. So you would choose the higher number in that assessment. So all of this is done in Qualtrics, and we can, once you've completed the assessment, we can send you the results for all of the teams within this collaborative, if you're interested in seeing those. But we really thought that the primary care team guide assessment was the best place for you to start and understand how your teams are functioning now. And then the second assessment, and I'm just gonna scroll back up, is once you've identified some of the gaps in terms of the way some of your team members are functioning, then you might want to start to implement some changes either to roles or to workflows. And so this assessment is the organizational readiness for implementing change. So you want to start with the practice assessment, and then the ORIC tool, which is the readiness assessment, might help you with the readiness to move your staff to new levels that fall on the primary care team guide assessment. So whether you're attempting to implement a new program, a practice, or policy within your organization, oftentimes that implementation can fail because leaders haven't established a sufficient organizational readiness for change. And so this is a way to assess that and what your staff thinks your organizational readiness is. And perhaps before you even start an initiative, this could be really a roadmap for leaders, clinical leaders, C-suite, to try and close some of those readiness gaps. So these are the 2 that we've suggested. There are also, and this can also be done in Qualtrics as well. There's another assessment that we've used in the Learning Collaborative, which is a role activity analysis. This is not part of your assignment, but we would be happy to send this out to teams if you're interested in also doing this. And when you think about the different roles within the teams, the role activity analysis is a tool that can be used to assess who's doing what. So you can assess, it'll have different activities, and then you check off who's doing them, the provider, the MA, the RN, the front office staff. And oftentimes what we found in the Learning Collaborative is that the provider column shows them doing everything. So there's check boxes in every single activity, but then there's some duplication of effort. So when you look at the RN column or the medical assistant, there's duplication in several activities. And so understanding where that duplication is happening can also influence provider burnout. And so that's another tool that we can provide, but we didn't want to overburden you with all those assessments. But again, happy to provide that to help you understand, where there might be some duplication of efforts. So just going back to the primary care team guide assessment, one other thing that I just wanted to mention, and what you're seeing here is just the section on the practice team, but as I said, it really breaks it down for some of the different roles. But a higher level, so level A, as I said, where you're really the highest performing practice workflows, processes, a higher level could also contribute to a reduced level of provider burnout. And again, that's not something that we have measured, but when you think about the roles of the support team, the MAs and the RNs, you know, if they're doing standing orders or if they have unduplicated some of those efforts, that really offloads the burden on the provider, which means that they are practicing to the top of their licenses, they being the MAs and the RNs. So that filling this out will also help you understand, you know, how those two roles are also functioning. So a lot of information. I hope I didn't talk too much, but wanted to give you just a little bit of background on the two assessments that we suggest you complete and have a better understanding of how your teams are functioning. And again, these can be completed in Qualtrics, or you can just print out a PDF. I believe, Suzanne, those might be available, but if not, we can send them out. But I think Qualtrics is the easiest way for you guys to complete that.
Yeah, Anna, thanks so much. Absolutely.
Yeah. Mm-hmm.
No, so we'll upload this in just a few minutes. And so folks will have this PDF version, but then they can also copy and paste the web link to take the surveys within the Qualtrics, excuse me. And then what we can also do, Anna, is we can also upload the link to the other survey that you were speaking of in our discussion board, so folks can have that option as well. And we will also post, for folks on the line, we will also post that on this week's assignment page under the assignment discussion, so you guys can see that there as well. So we can keep everything together in this section here.
Perfect. And the role activity analysis is it's not in Qualtrics, it's really a PDF. So, you know, you hand one out to each member of the team and they check it off depending on their role, and then you look at them and sort of assess, all right, where are we duplicating efforts? So that's a PDF, and we'd be happy to, I'll send that to you, Suzanne, right after this.
Perfect. Thanks so much. Yeah, I know this looks really wonderful, and I know that folks will they'll definitely be useful as they're looking at their team-based care models. Does anyone have any questions that come to mind as Anna was going through the assignment, or you know, any initial thoughts or questions as you're looking at things? And we can go ahead and take folks off. Sure, yeah.
I just want and I think I think my contact information is shared. So if anyone has specific questions while they're looking at these assessments, we'd be happy to answer them. We have an evaluation consultant who works on our project for team-based care. And so she is the one who chose to use these specific assessments. And so we'd happy to bring her into the conversation if there are questions that I can't answer.
Great. Thanks so much. Okay, it doesn't look like we have any questions that are coming in regards to the assignment just yet. So what we'll do with the rest of the about 16 minutes we have here is we will go ahead and pull up the questions that came in as a result of, or rather during the webinar last week, and give Anna a chance to answer those questions. Okay, and I just pulled those up, so you guys should be looking at those questions that came in last time.
Great, and thanks so much to those who submitted questions. It's great to have you all engaged in this conversation. So Vina is not on the call today, but I did pass these questions along to her. She was the one who provided the presentation last week, and she's our Chief Medical Officer, but I did connect with her to try and get some responses, and the ones that we didn't get to, we will certainly follow up again, and Suzanne can send those out or post them to your discussion board. But starting with the first one, in terms of a decrease in provider burnout, this is something that's been really hard to measure, and I'm sure you all have that similar thought. But if we were defining the burnout year to year, then yes, it has decreased. But as we noted in the webinar, time alone is certainly a risk. You know, the longer a provider works, the longer there is a risk of burnout. So again, it's not something that we've measured, but we did actually talk with our HR department and ask about, you know, what specific efforts we are doing to measure provider burnout, because burnout isn't necessarily defined by retention. And so we're trying to differentiate between that. But so we don't have a clear answer on that. I apologize. We haven't, it's not something that we've specifically measured, but, you know, I think that we've definitely seen a shift in our provider workflows and models, and once we adapted, you know, some of these best practices in terms of team-based care and sort of assessing the role and activities that all of our team members are doing. The second one was answered live on the webinar. So the third one, in terms of leadership training, we go over this during provider orientation. Vina does a 4-hour orientation for all of the providers when they join our organization, and a part of this training is training to our specific model of care and really how the providers, can leverage the team to work to the top of their licenses. So it's going back to, you know, assessing the roles and leveraging the team, and, you know, supporting the team members and taking on the responsibilities that we expect from them. We don't have any specific leadership training that we do for providers that's ongoing, but it's part of the orientation and onboarding process. The nurses, in terms of the nurse phone calls, I'm not sure, Vina did not answer this one, and I can certainly defer to our Chief Nursing Officer, Mary Blankson, on this one, but we do have nurses who take triage calls. We have a call center at our organization, and so we have RNs who are specifically hired to do triage through our call center. So I'm not sure who asked that, or if that answers your question. But if the person who did ask that question about the nurse phone calls, if you have anything more specific that you want to hear about, we'd be happy to follow up. We do bill for RN visits here in Connecticut, and the phone triage I just answered, but they are triage nurses who we hire specifically just for that role. They are not part of the clinical team that sees the same patient-provider panel. The MAs do not do phlebotomy. That is correct. Connecticut, in our state, does not allow MAs to give vaccines or administer treatments. And in terms of the dashboard being a function of the EHR, the dashboard is actually separate from our EHR. I know Vina talked a little bit about some of the dashboards that our providers use, and we have a few webinars that specifically talk about all of the dashboards that our providers, our MAs, and our RNs use. We have a business intelligence team here at Community Health Center that works with our clinical teams and our quality improvement teams to develop these dashboards. They work with our EHR, but they are not developed from the EHR. And if you have more specific questions about our dashboards that we use, we'd be happy to follow up again or connect you with folks from our business intelligence team. We have a webinar tomorrow on pain, and we have some of our business intelligence folks talking about the development of dashboards that we use specific to pain and how all of the team members use them. So we'll be answering some questions about that as well. The second to last question asks, so often our health center leadership gets caught up in the fact that physicians' visits are not reimbursable. Has CHC done a cost-benefit analysis on this model? If so, can it be shared? And then similar to the warm handoff. So that I didn't get a response from Vina, so that is one that we certainly will follow up on. We just ran out of time when we were going through the questions, and I don't have a specific answer on that, so I apologize. But as I said, the questions that we don't have responses to, we certainly will follow up and have Suzanne post them. And then the second is measuring our successes in reducing burnout. As I mentioned earlier, it's not something that we have specifically measured, but we're working with our HR department to see how we can measure it. And as Vina said, if we were looking at it on an annual basis, it looks good. We're retaining providers, but again, retention does not define burnout, and so we're looking at ways to measure that with our provider teams. So I ran through that quickly. I know we're short on time. I didn't know if there were other things that we were going to get to today, but if there were other questions that came in as I was explaining that, I'd be happy to attempt to answer those, but I can also follow up with Vina and Mary, our Chief Nursing Officer, if there are specific questions that you have for them.
Yeah, Anna, thanks so much for answering those questions that came in last time. And it looks like we've had several questions come in as you have been answering the questions from last week. So some folks are asking if you should have all staff complete the assessment. No, that would be kind of a heavy lift. So we would suggest taking one clinical team, depending on their model, but even if it's a team lit, a provider, an MA, and then a clinical director. So maybe a clinical director at a specific site, or a chief medical officer, chief nursing officer. And I think it'd be interesting to get the different perspectives from them, and understanding how they see the practice functioning through their lens. But it does not need to be a site-wide distribution unless that's something that they're really interested in seeing. I think their results, might be overwhelming, but we'd be happy to sort of break it down per site. If they sent out the link to everybody, we can, as long as they fill in what health center they're from, we'd be happy to break down the results for them and give them that information. Great. Thank you so much. Okay. And then another one that came in said, how do we approach answering the team practice assessment when it's worded, quote, people who work here, quote, when you don't really know? Don't really know how they feel about team-based care.
I would suggest, if the person filling out the assessment doesn't know the answer to that, I would suggest maybe asking, again, a few members of a clinical team how they would respond to it and come to a consensus on that response. Or if there's just a question that you don't truly know the answer to, or how team members might respond to that, then they can leave it blank.
Great, thanks. Next one is, if you have multiple sites, do you want us to choose one to complete the assignment?
Yes. Again, it's at the discretion of the organization filling it out. We'd be happy to provide the responses to the organization based on who they send it out to. We just thought, in terms of the lift for you all, that it might be better to minimize how it's distributed and what your expectations are in terms of having a large number of people fill it out. But if you wanted to blast it out to several sites, that'd be fine too. I know at Community Health Center and the teams that were participating in the Learning Collaborative, we just had one clinical team fill it out. So it would really depend if you have an organization, or sorry, a site that might need some more support, or where you think you might want to implement some practice transformation initiatives, then that might be the site that you would identify to fill it out.
Okay. And I think that is all of the questions that we have regarding the assignment. Looks like we did have another question come in regards to the questions from last week. And this one is, my understanding is that Medicare does not reimburse for nurse visits, RN visits. How are you able to bill for them?
That's a great question, and I don't know the answer, but I can certainly try and get the answer while we're on the call. But from what I understood is that we in Connecticut can get reimbursed, but I'm going to find out right now.
Okay, and if for some reason you aren't able to get the answer, we can certainly work on that and then get that out to the folks that were asking. And then this is all fantastic. I love this interaction. This is great. And I hope you guys are enjoying this too. And we can certainly, you know, if there are questions, again, that come up as you're working through the homework, feel free to post them in the discussion board or send questions to Anna, and we can, you know, we can make sure that we get them to her. And we're just really excited for you guys to fill this out and see where it takes you guys to the next level in your teams.
And this is Anna again. So as I said, if anybody has any questions or you need some assistance when you're filling out the assessment, please feel free to reach out. We'd be happy to answer any questions after this call. And I'm still waiting on the Medicare reimbursement for RN visits here. So as Suzanne said, if I don't get the response within the next 2 minutes before our call ends, then I'll be sure to follow up with Suzanne and she can post it on the discussion board. But thanks for the question.
Yeah, absolutely. And we just, again, want to thank Anna and the team from CHC Inc. for taking the time to be a part of our learning collaborative. And I know there's some great interaction on both the webinar last week as well as the homework discussion this week. So I know you guys are excited to take these assessments and see where they take you all. So unless there are any other questions, we'll sign off for this session, and we look forward to everyone's posting after they are able to complete their assignment.
Great. Suzanne, thank you so much for inviting CHC to participate, and I'm really looking forward to seeing some of the assessments come in from these sites and collaborating with them in the future if they have other questions.
Wonderful.
And I just want to follow up. I just want to quickly follow up. I know it's 1 minute. So I just reached out to one of our RNs. And here in Connecticut, there are RN visits, but the provider signs off as a standing order. So we bill it under the provider. And I don't have all of the details, but I think they bill it as a provider visit under a standing order for an RN. So happy to follow up with whoever asked that question if I get more information.
Wonderful. We've definitely taken a note of that, and we will certainly, if you find any other information in regards to that, we can certainly follow up follow up with them.
Perfect.
But thanks so much again, Anna, and thanks to everyone for their time today. And we look forward to seeing your results on the discussion board and talking to you guys next Wednesday. Take care, everybody.
Thank you.